Today we are going to discuss about the coronavirus disease. We will see what are the diagnosis, what are the clinical presentation, and the imaging department consideration, as well as various imaging modality that can be performed or the examination can be performed to appreciate the various changes that occur in the patient's anatomy if he got infected with a coronavirus. Okay, so coronavirus disease is basically an infectious disease that is caused by a severe acute respiratory syndrome, coronavirus 2, which is previously known as a novel coronavirus in the year 2019. Okay, so the first case was seen in Wuhan, China, before it will spread globally, and currently it is being recognized as its outbreak is being recognized as a pandemic on 11 March 2020. The image specification are most commonly of atypical recognizing pneumonia with a bilateral, peripheral and basal predominant distribution. If I talk about the diagnosis of the severe acute respiratory syndrome coronavirus 2, then a definitive test for SARS coronavirus 2 is basically a real-time reverse transcriptase polymerase chain reaction, okay, which is also known as RT-PCR test, which is highly selective, and it the sensitivity report as low as 60 to 70% and as high as 95 to 97%. Hence, the false negative finding are a real clinical problem. Hence, a several negative tests must be performed for the same cases in order to exclude or to get a confidence to exclude the disease. Okay, so if I talk about the clinical presentation, then the COVID-19 clinically present with a systemic and a respiratory manifestations. The individual who got infected with COVID-19 generally asymptomatic and act as a carrier, but few experiences a mild gastrointestinal as well as a cardiovascular complications and the disease. Okay, however, its clinical manifestation has to be determined, but the signs and symptoms are most commonly of a fever, which is generally occur in about 85 to 80%, cough, which is 65 to 70%, and sometimes there is a presence of a fatigue 40 to 45%. There is a sputum production that is about 35 to 40%, and a shortness of breath is about 15 to 20%. In mild symptoms that is generally occurs in a person which infected with the COVID-19 virus, it's basically a there is a chills, pleuritic pain, and there is a presence of a throat 15 to 20% of the cases. Then there is a athalgia in 10 to 15% of the cases, and in severe cases it has been seen that the patient may experience a nausea, vomiting and a chest tightness. Okay, consideration of the medical imaging department. The main consideration of the medical imaging department is infection prevention. The radiological technologists and the medical imaging technologists are the first line person who are contact with the COVID-19. Hence, the infection prevention and the infection prevention guideline are imperative and has to be followed strictly. Okay, the main important thing is to in order to prevent the infection is to use the personal protective equipment like the medical masks, gloves, eye protectors, goggles and gowns, etc. The N95 mask is very effective. Okay, if the patient requires a general radiography, then it should be done portably in order to avoid the transporting the patient from one place to another, or it can be performed in a dedicated auxiliary unit. Okay, if the patient has to be transferred to the department for the radiological investigation or the radiological examination, then patient must wear a mask in moving in and out of the department and the ward, etc. Okay, so the machines that are used for the examining the coronavirus infected patient has to be cleaned after the examination properly. Okay, and also the equipment, the stationary equipment that are used while performing the examination of the patient must be clean. Okay, so as we know that the SARS coronavirus exits for about 72 hours in the surface, so it is very important to provide protection to our various kinds of equipments, particularly the cassettes particularly cassette and the patient's couch by covering it with a cover which acts as a barrier. Okay. Also, it is very important to avoid the intra-articular steroid injection, perineural steroid injection, because these steroid injection tend to reduce the immunity of a person. In that case, the immune system of that person will get suppressed or immunity get decreased, which will increase the chances of coronavirus infection to that person's. Hence, it should be avoided as much as possible if it is not too much important. Okay. If the CT scan is performed in the patient who is infected with the coronavirus, then a non-contrast computed tomography should be performed unless the contrast media is indicated. However, in order to perform the CT pulmonary angiography, it is very important to administer the contrast media, and it is recommended that it is very important to take the non-contrast image prior to the administration of the contrast media, because contrast will suppress the appearance of the glass ground opacification pattern. Okay.